you're over the age of 70, or you care for someone who is, today's video is not just another health tip. It's potentially life-changing. We're diving deep into a subject that every senior, caregiver, or family member must pay attention. The 5 critical things you must know before having surgery after 70 to recover faster and avoid dangerous complications. As we age, surgery becomes more common, whether it's for a hip replacement, heart bypass, cataract removal, or any other major or minor procedure. Thanks to incredible medical advancements, people in their 70s, 80s, and even 90s are now safely undergoing surgeries that were once considered too risky. But that doesn't mean it's easy or risk-free. Older adults face unique challenges before, during, and especially after surgery. The recovery process can be longer and more complex, and the risk of post-operative complications, cognitive decline, infections, and decreased mobility can increase significantly. That's exactly why this topic is so crucial. We're not just talking about the surgery itself. We're talking about how to prepare intelligently, recover quickly, and maintain your independence and quality of life. Whether you or your loved one is facing an upcoming procedure, it's vital to go in with the right game plan. From physical readiness to mental resilience, from dietary prep to medication management, we'll cover everything you need to know to improve your surgical outcomes and reduce risks. This video isn't just a guide. It's a complete survival roadmap for anyone entering their golden years and preparing for surgery. So whether you're dealing with a scheduled operation or just want to be prepared for the future, stick around, because the information we're about to share could be the key to a faster recovery, fewer hospital readmissions, and a stronger, healthier you. Thing 1, understand the risks and prepare for them the smart way. As we grow older, particularly beyond the age of 70, our bodies naturally go through a series of physiological changes that significantly affect how we respond to surgery. That's why the first and perhaps most crucial step in preparing for any medical procedure in your senior years is to fully understand the age-related risks, and more importantly, how to proactively manage them. Avoiding surgery isn't always the answer. Being prepared is. Let's break down why this matters so much. For seniors, the immune system often doesn't respond as swiftly as it once did, which raises the likelihood of post-operative infections. Your body's ability to heal also declines with age, meaning that wounds and surgical incisions can take longer to close and regenerate. There's also a greater chance of adverse reactions to anesthesia, including temporary confusion, memory issues, or post-operative delirium, which is particularly common among older patients. On top of that, the heart and lungs are under more strain during surgery, increasing the chance of cardiovascular complications. And don't forget mobility challenges. Seniors may experience muscle weakness, joint stiffness, or even develop dangerous blood clots like deep vein thrombosis, DVT, due to extended periods of immobility during recovery. Pro tip for seniors and caregivers: before you even schedule the operation, insist on a comprehensive geriatric assessment, CGA. This isn't just a regular checkup. It's a thorough evaluation conducted by a team of specialists, including a geriatrician, a nutrition expert, a physical therapist, and a pharmacist. Together, they assess everything from your cognitive function and nutritional status to your medication interactions and physical strength. The goal is to create a customized, senior-friendly preoperative plan that optimizes your body and mind before going under the knife. This kind of preparation is proven to reduce complications, shorten hospital stays, and improve recovery outcomes. By taking the time to recognize these risks and implementing tailored strategies to manage them, you or your loved one can enter surgery with a well-informed, confident mindset, and most importantly, a much higher chance of a smooth, safe, and successful recovery. Thing 2, build physical strength and stamina before surgery. Prehab is the new rehab. One of the most overlooked yet game-changing ways to prepare for surgery after the age of 70 is to build your body's strength and stamina in advance. It's called prehabilitation, or simply prehab. a structured program that helps older adults improve their muscle tone, cardiovascular endurance, balance, flexibility, and breathing capacity before undergoing surgery. Think of it as training your body for recovery before the procedure even begins. Why is this important? As we age, our bodies naturally lose muscle mass, a process called sarcopenia, which makes recovery from surgery even more difficult. If you enter surgery already feeling weak, inactive, or with limited mobility, you'll likely have a longer hospital stay, face slower wound healing, and have a higher risk of falls, blood clots, pneumonia, or functional decline. On the other hand, even a few weeks of guided physical activity before surgery can dramatically improve your ability to bounce back faster and regain independence. What should prehab include for seniors? Tailored exercise programs, designed by a physical therapist or rehabilitation specialist, familiar with senior physiology strength training to improve your core, legs, and grip strength. Light aerobic activities such as walking, stationary cycling, or water-based exercises to boost cardiovascular health, stretching, and mobility routines to maintain joint flexibility, and range of motion breathing exercises or respiratory therapy, especially before lung or abdominal surgeries, to reduce the risk of post-operative pneumonia. Bonus insight: talk to your healthcare provider about joining a senior-focused prehabilitation program. Many hospitals and rehab centers now offer customized pre-op fitness regimens for older adults, sometimes even covered by Medicare or insurance. Starting early, at least 2 to 6 weeks before surgery, is ideal. Don't forget nutrition during prehab. Physical preparation also includes eating foods rich in protein, vitamin D, and essential minerals like zinc and magnesium. These nutrients are vital for building muscle strength and boosting immune response. A dietitian may recommend supplements or specific meal plans to support your energy levels and healing capacity. Avoid this common mistake. Many seniors feel they should rest up before surgery. While rest is important, total inactivity before surgery can make you weaker, not stronger. Proper movement and light training under professional supervision are far more beneficial than bed rest in most cases. Thing 3. Medication management can make or break your surgery. Don't overlook it. When preparing for surgery in your 70s or beyond, there's one essential area that often doesn't get the attention it deserves: medication management. For many older adults, this can be the hidden key to a safer surgery and a faster, smoother recovery. Let's be honest, by the time we reach our 70s, most of us are taking multiple medications daily, not just for one condition but for several. These might include prescriptions for blood pressure, cholesterol, arthritis, heart disease, diabetes, sleep, and more. In fact, it's not uncommon for seniors to be on 10 or more daily medications, a situation known as polypharmacy. Add supplements, herbal remedies, and over-the-counter drugs to the mix, and the potential for dangerous drug interactions skyrockets, especially during and after surgery. What can go wrong without medication management? Surgical procedures require anesthesia, sedation, antibiotics, and post-operative pain relief, all of which can interact dangerously with the medications you're already taking. Here are just a few examples of what can go wrong. Blood thinners like warfarin, aspirin, or clopidogrel can cause excessive bleeding during or after surgery, if not paused or adjusted properly. Diuretics and ACE inhibitors, commonly prescribed for blood pressure and heart issues, can disrupt electrolyte balance and blood pressure regulation during anesthesia, causing complications like low blood pressure or arrhythmias. Sedatives, antidepressants, and antipsychotic medications can significantly increase the risk of post-operative delirium, dizziness, confusion, and dangerous falls. NSAIDs and certain supplements such as ginkgo biloba, vitamin E, or fish oil may also thin the blood and increase surgical bleeding risks without patients even realizing it. Your action plan: how to manage medications before surgery. Create a full medication inventory. Make a comprehensive list of every single medication and supplement you take, including dosage, frequency, and even over-the-counter remedies. Bring this list to every pre-surgical consultation. Consult a geriatric pharmacist or your doctor. Ask your doctor to refer you to a geriatric pharmacist or clinical pharmacologist. These specialists can review your list and identify high-risk combinations, unnecessary medications, or drugs that need to be adjusted, stopped, or replaced before your procedure. Request a medication reconciliation meeting. This is a formal review of all your meds with your surgical and anesthesia teams. It helps prevent errors and ensures that your surgical team knows exactly what you're taking, which can literally save your life on the operating table. Plan for a medication holiday. If necessary, for certain medications that increase surgical risks but are not absolutely essential in the short term, your doctor may recommend a temporary pause, known as a medication holiday. This is especially important for blood thinners, diuretics, and some psychiatric drugs. However, this must be done under medical supervision. Never stop any medication on your own. Update your medication plan for recovery after surgery. Your medication needs may change. Pain meds, antibiotics, and anesthesia can interact with your regular drugs, so it's vital to reevaluate your prescriptions post-op to avoid side effects like constipation, confusion, or impaired healing. Pro insight from Senior Buzz. Many hospitals now offer preoperative medication clinics or geriatric surgical programs that specialize in managing complex medication regimens in older adults. Ask your care team if such a service is available and take advantage of it. It's one of the best ways to reduce surgical risk and improve outcomes. Real-world example: a 76-year-old patient preparing for a routine hip replacement was unknowingly taking a combination of aspirin, ginkgo biloba, and fish oil, 3 substances that all thin the blood. Without proper review, this could have led to life-threatening bleeding during surgery. Thankfully, her surgeon required a complete medication review beforehand and avoided what could have been a disaster. Thing 4: nutrition and hydration. The unsung heroes of senior surgical recovery. There's a reason people say, "You are what you eat." And for seniors preparing for surgery, this couldn't be more true. For adults over 70, proper nutrition and hydration before and after surgery are not just beneficial, they're critical. As we age, slower metabolism, reduced muscle mass, and decreased appetite can all lead to subtle but dangerous nutritional deficits. Many seniors unknowingly enter surgery in a state of malnutrition or chronic dehydration, even if they appear healthy on the outside. This significantly impacts healing, increasing the risk of infection, muscle weakness, delayed wound, recovery, hospital readmission, and even post-operative confusion or delirium. The good news? Nutritional planning can start today. Increasing protein intake from lean meats, eggs, yogurt, lentils, and nuts can promote tissue repair and immune resilience. Adding healthy fats like avocados, olive oil, and fatty fish helps control inflammation, while antioxidant-rich fruits and vegetables support healing at the cellular level. Hydration plays an equally vital role, boosting energy, improving circulation, and helping prevent complications. Seniors should begin increasing water intake at least 2 weeks before surgery, and consider consulting a registered dietitian for a personalized preoperative nutrition plan. Even after surgery, small, nutrient-dense meals, soft foods, and key vitamins like zinc, vitamin D, and B12 can speed up recovery. Consider the case of a 74-year-old woman whose first surgery resulted in slow recovery due to poor nutrition. But when she focused on high-protein, vitamin-rich foods before her second procedure, her healing was quicker, her energy returned faster, and she regained mobility far more efficiently. Bottom line, food and fluids are your body's most powerful tools for healing. Don't wait until after surgery to take them seriously. Start fueling your recovery now for the strongest outcome possible. Thing 5: post-operative planning. Because recovery starts before the surgery, One of the most common misunderstandings, especially among seniors and their families, is the belief that recovery only begins after the surgery is done. The reality is quite the opposite. Successful recovery starts before the operation ever takes place. For individuals over 70, simply showing up for surgery is not enough. Older adults face unique risks such as longer healing times, hospital readmission, and even loss of independence if recovery isn't carefully planned. Without preparation, issues like delirium, falls, missed medications, or avoidable stays in rehabilitation centers can occur. But with the right planning, these risks can be significantly reduced or even eliminated. Preparing your home for safety, arranging post-surgery help, organizing medications, understanding warning signs of complications, and taking care of your emotional health are not just helpful steps, they are essential. Recovery is not a passive event. It is an active, intentional process that starts well before the first incision is made. With thoughtful preparation, seniors can not only heal faster, but also return to living independently and confidently. Don't wait for surgery day. Start planning now, because the road to a strong recovery begins today. Surgery at any age is a serious decision, but when you're over 70, the stakes are higher and preparation is everything. With the right steps, your body and mind can bounce back stronger and faster than ever. Whether you're planning joint replacement, a heart procedure, or even a cataract surgery, this video should serve as your step-by-step guide for proactive healing. If you found this video helpful, give it a like and share it with someone you care about, especially if they're navigating surgery in their senior years. Comment below if you've had surgery after 70, or if you're preparing for one. We'd love to hear your experience, and your story might just help someone else.